Hi, I'm Michael Vargas. This is my newborn assessment. I live in a house of boys, so I do not have a baby doll. So this will have to be my baby. Um, Prior to coming into the room or going to assess baby, I'd want to get the birth history on baby, either from parents or I could get it from the baby's chart. Um, just knowing if it was a vaginal or a cesarean section, and then also checking for any kind of complications that might have been present for birth. After that, then I could move along to going to actually see baby, and if they're with mom and dad, I would introduce myself as a nursing student here to do a newborn assessment, head to toe on baby. And so if they're carrying baby, then I could do my best to do that with them carrying the baby. And so after I have made sure that there is patient dignity, safety, such as baby either being held by mom or dad, or that baby is in a proper crib and nice and warm for the examination, and I performed hand hygiene, I can go ahead and start my assessment on baby. First things that I want to do is going to be vital signs. I would be taking baby's respirations if they're hopefully calm at the time, gently placing my hand on the baby's chest and counting for a full minute their respirations. And then while I'm there, I will also do an apical pulse, which means that I'm listening right to the center of baby's chest, also for a full minute, and counting the pulse rate. And then getting a temperature in the axillary area of baby as well. After I have the vital signs, I want to take a look at baby's overall general appearance, see their muscle tone, if they're crying, what kind of crying would I describe that as, if baby is hopefully nice and calm, and we can go ahead and do a full assessment on them. And just looking at, there's just symmetry with baby as well. Nothing that would immediately jumps out to you as something that you need to look at and something you need to make note of. And then moving along to baby's measurements, we would be measuring baby's weight. We would also be measuring baby's length from the bottom of their feet to the tops of the head. I would also want to be taking a measurement of baby's head. If baby had a brow area, I would be measuring from the brow all the way around baby's head, and also taking a measurement from baby's nipple line all the way around for their chest measurements. And there should be a differentiation of the sizes. The head should be slightly bigger, about 2 centimeters or so larger than baby's chest would be. Head should always be the largest part of baby. And then I could move on to baby's head, and that would also include then checking the anterior and posterior functionals on baby's skull, if baby had them on here. I would want them to be nice and flat. I wouldn't want to see any kind of bulging or sunken in. That could mean a fluid imbalance for baby. And so that's also why you don't want to do that when they're crying, because if baby's crying, it might look like there's a bulging, but there's not. And so you could get a false bulging effect that has nothing to do with their fluid. While also looking at baby, I would want to look at their face at this point, just seeing that let's go back to head. For baby's head, I could see molding of the skull, and that could just be from the pressure of vaginal delivery. You might also see cephalohematoma either on one side or the other, or both for baby. That's just where blood is collected in that layer. Again, it's usually from the birthing process. And you might see caput, which would be generalized edema of baby's whole head. And so, yep, that's when I could move on to baby's face, where I would be looking for symmetry, for baby. Even you can see the ears if they were here. And when looking at baby's eyes, babies aren't going to be able to accommodate light the way that a mature eye could. However, we would be able to still shine a light and see that they react to the light. The pupils should still be equally round and reactive to their light shining in. We'd want to take a look at baby's conjunctiva, making sure there's no signs of conjunctivitis or anything. We would look for baby's ears they would be at the edge of baby's eyes, and that should be the top of baby's ears. And at this point, then we would see that the ears should be shaped like normal ears. We would also be checking that sometimes there could be some vernix, which is in the ear. It's completely normal. If there's no misshape into the ears, then those are good to go. We would check baby's nostrils. Their nares are bilaterally patent. Babies need to breathe out their nose, so they need a nice clear nose. And when assessing baby's mouth, we would have a gloved hand and we could stick our little pinky in. We would be checking their hard and soft palate and making sure that that's still intact, or that it is intact, that there's no openings or abnormal openings in there. We could also, while looking into having our finger in baby's mouth, it might try to suck and swallow. So we can kind of check that that's normal for baby, or if we've been able to have the opportunity to see baby feeding, we could see that they were doing that normally as well. And that helps with our reflex assessment later. And also with baby's mouth, while we're able to look inside, we could see if there are signs of Epstein's pearls, just little white spots that might appear on the palate or the gum lines area. It's completely normal. And then moving on to if we start to look at the whole of baby would not be sitting upright, but whole of baby, we would also be able to assess their skin, which I should have done that with the generalized appearance, but I'm going to backtrack a little bit. For skin, we could see vernix on baby, which is just that white layer that might be on different parts of the skin, usually found in folds and things like that still after birth. If it was a preemie baby, it might not have it as much. If it was a late baby, it might not have it either. But that's just a protective layer on baby, and it goes away soon. And also, I'm finding a little cold, so sorry that I keep sniffling. Also, what baby might have could be baby hairs, or lanigo, and that's going to be hairs that we might find on baby's shoulder or their back. Also, there could be milia on the bridge of baby's nose, little white spots that are going to be found there. I guess that's also, it's normal, and if somebody, if parents are a little concerned of it, it's a normal process. Also, what's called baby acne, erythema toxicum, could appear on baby's face. And again, that's completely normal. It will look like baby acne. I think that's good for skin. And then we could move on. I was about to do baby's neck. And with baby's head or neck, we're just going to place our fingers between the head and the clavicle area. And while doing that, we could also feel the clavicle, that it's still intact, that there's no trauma from birth, and then no noises or anything like that as well when we're pressing on it, no over discomfort for baby. And then moving on to baby's chest, we would want to see that when baby is breathing, that there's some symmetry in the chest. We would want to make note of any abnormalities that could show, such as if there is an extra nipple on baby, if they're not symmetrical on each side of baby's chest, and if they were also enlarged or anything, we would want to make note of that. And if I hadn't already taken vital signs, this would be a good time to take baby's Apical pulse again to possibly listen for any kind of heart murmur, which is completely normal at first. This is also where I would be taking breath sounds on baby, noting that if there is some extra fluid sounds, that's also very normal for the first hours after birth for the baby. And then moving on to baby's abdomen, I would be taking a look at baby's umbilical cord. If it's a very fresh baby, I could see the 2 arteries and 1 vein in the umbilical cord. If it's not, I would want to make note of how the healing is going for the baby in the umbilical cord area. So just generalize, making sure there's no signs of obvious infection or overly bleeding for baby. I would listen to bowel sounds at this point as well, asking mom and dad or the chart if there has been already any kind of voiding. Baby's voiding normally if it's past the meconium yet at this point. And just auscultating baby has a nice soft belly. Moving into the genital area, we would be assessing if the patient is a female, that it has the labia and that it covers the clitoris. We would also note of any kind of discharge from the vagina, so including bleeding, we want to make note of that. If baby was a male, however, we would be making sure that the meatus is centered. We'd also be making sure that the testes are in the scrotum. We would be making sure that the scrotum had rugae, just the folds in the skin. And after that, we would also, like I said before, though, we would have also asked about the baby voiding. And then we could move on to extremities. What I want to see is that baby is able to move all of their extremities normally, the full range of motion, up, downs, no problems, no clicking noises, nothing that's going to alarm me, including with moving baby's hip by bringing the feet up and making sure that equally both sides are able to have a full range of motion. There's no extra discomfort or any signs of trauma on baby. I would also be checking the extremities, that making sure that each hand has 5 fingers, each toe has 5, or each foot has 5 toes, and checking baby's feet. And then I could move along to the, I could check the back of baby. Along the spine, I would be feeling, just making sure that there's no openings in the baby's spine. I would check that the baby's anus is patent as well. A quick finger swipe, and then seeing that the muscles should be reactive. And sorry, cat hair. Moving along to baby's reflexes. First reflex I want to note is the moral reflex, like the startle reflex, by keeping baby safely in my hands, of course, never taking my hands off, but doing almost like a dropping motion with baby. Baby should flare out, have an instinctive reaction to that. Also looking for tonic neck in baby. When baby is laying down, if baby is facing to one direction, say left, the arm would be placed next to their head, like in this position, and the other arm should be nice down, right at baby's side. And if the opposite was true, baby's doing that as well on both sides. Another reflex that I want to look at is when I was probably looking at extremities, would be a very good time to, when I'm counting, the palmar reflex, just by putting my finger by baby's hand, that their fingers grasp around my finger, and doing the same plantar with baby's toes, that they curl around my toes. The Babinski, by touching bottom of baby's foot, coming up and going around near the toe line or center, like right beneath the toe line. Baby's toes should flare. And I want to see that as a positive result for that reflex as well. And when messing with baby's feet, it's a good time to see if this was on a nice flat surface, that baby is stepping, having the stepping reflex as if they're already able to walk. And then when baby is feeding, that's when I would have been able to see. And when we had inspected the mouth, we were able to talk about that baby was sucking, swallowing, and also with babies' last reflex, we would be talking about the brooding reflex. So if we touch the side of baby's face, it should turn to that direction. We would also be able to look for trunk incurvation. Essentially, I'll think of it. When you have baby's spine, you touch the side of the spine. And when you do that, baby should move towards that trunk incurvation, doing that to each side and seeing that baby moves to each side. Of course, I would not be handling babies so quickly and roughly. Also, let me think. I think that is pretty much what my assessment would be. Yep. Okay. After that, I of course would make sure baby's nice and safe. I would either hand him off to mom and dad, or I would put him or her in the crib. Make sure again that they're warm, that their dignity was intact throughout the whole time. I've been performing hand hygiene, thanking everybody for their time if there's the parents in the room, and documenting my assessment. All right, thank you.